Right, now, one of the most important questions that we get asked about veneers, and it's a very important question, is what type of material should I be using for these veneers? Should I be using ceramic or should I be using resin composite? So in other words, should I be doing cosmetic bonding? And ultimately it comes down to the wear and tear on the specific patient. So in other words, how far am I into this wear and tear process? How much natural tooth structure, and then specifically enamel, which is our protective layer. How much of this enamel have I actually lost? Because we have to understand that nobody's going to get to 90 with their teeth looking like they were 10 years old. The teeth unfortunately can't fix itself, so we have to do something at some point to be able to help patients to get to an older age with their teeth. And this is then a very important aspect of when I'm going to choose the type of material for this patient. In other words, it comes down to, if I've got a lot of enamel left, and this is going to again differ from patient to patient, obviously we don't want to destroy that enamel, and then I will be looking to braces, I'll be looking to resins, ultimately to do as little damage as possible, to get as much out of the tooth as possible. But you see, the moment we start losing enamel, and the more enamel we lose, we will need to have stronger materials, more durable materials, because resin in the end, are not really designed to be able to take all of the bite forces that we throw at it. So ultimately, the more material, the more enamel that I've lost, the stronger material I'm going to use, and the more supported it will have to become. So in other words, if I have zero enamel loss on a patient that's got maybe a chip on a single tooth, surely I'm going to use a resin. But I've got a whole section maybe lost on a patient, and then restoring that section, giving the rest of the teeth and the materials the support that it needs, I'm possibly going to have to use a more durable material like a ceramic instead of having a resin. So ultimately, I think the confusion lies that resin veneers versus ceramic veneers are not really an alternative to each other, but it's more about where exactly in the sequence of wear and tear am I, and then of course, a lot of other aspects like cost, etc., etc. But as long as the patient understand what the specific pros and cons of these materials are, we can make an educated decision with them. How many teeth are we going to have to treat for the support, and ultimately what type of material are we going to need?